Welcome to Angel Health Academy. Topic for the day or topic for the session is responsibilities of a nurse manager or a nursing superintendent in planning budget for nursing department. A nurse manager or nurse administrator or a nursing superintendent plays a key role, an important role in planning the budget for the nursing service department or the ward or the total wards of the hospital for ensuring or make sure financial sustainability, sound financial management or continuation of the or continuity of the ward while maintaining high quality patient centered nursing care services, high quality and comprehensive patient care services. So a nurse manager play an important role or key role in planning the budget for the nursing service department for the smooth functioning, which ensure the financial sustainability or continuity, sound financial support. At the same time, maintaining the high quality patient care services or high standard of nursing care services in the department or in the hospital or healthcare setting. The major responsibility of a nurse manager or nurse leader or nurse administrator or nursing superintendent in the hospital are: first one is assessing the departmental needs. Assessing the nursing department needs in the hospital or healthcare agency. Second is staffing and labor cost. Determining the staffing and labor cost in the hospital or nursing department. Third one is supply and equipment management. Supplies and various medical equipment management in the ward. Fourth one is monitoring and analyzing the utilization of resource ward. Monitoring and analyzing the utilization of utilization of the resource available in the nursing department. Fifth one is collaboration with the finance and other department. So collaboration and cooperation or coordination with the finance department in the hospital or other department for the sound sustainability of the budget. Then sixth one is forecasting the budget, that is budget forecasting, overseeing the expenditure and income and balancing the budget. Then seventh one is managing operational cost. So managing the functional cost or expenditure of the particular department or wards or hospital. Eighth one is variance analysis and reporting. If any changes from the proposed budget in the actual budget, the variance, the factors, and analyzing that factors and reporting to the finance department or the executive of the or the higher authority of the hospital department. The ninth responsibility is incorporating the quality involvement initiatives or programs in the hospital based on the available budget. Incorporating quality involvement initiatives or programs. 10th one is risk management and contingency planning. Risk management, when there is an emergency situation or when there is any disaster, managing that particular situation. That is risk management and contingency planning of the budget for the emergency management or the emergency utilization of the available budget. The last one is 11th one is compliance with the or follow up with the legal and regulatory requirements as per the regulatory bodies. Compliance with the legal and regulatory requirements. So these are the 11 important responsibility or function of the nurse manager or nurse administrator or nursing superintendent in the hospital or in the healthcare system. Let us discuss in brief about the this 11 responsibility of the nurse manager in this video. First one is assessing the departmental needs. Assessing all the needs of the nursing departments in the hospital. The nurse manager must evaluate, must observe, or monitor the current and future needs of the particular nursing department or all the nursing departments. So nurse manager must evaluate or monitor, continuous monitor of the current, present and the future needs of the finance or budget for the nursing department. This involves analyzing the staffing level, finding out how many staffs are required, analyzing the staffing level, number of staffs are required according to the type of the patient in that particular nursing department or ward. Then analyzing the patient care demand, that is according to the type of the patient, what is their needs and demands or problems. Then analyzing the equipment necessary to render the quality services in that particular department and other supplies needed for patient care and other resources, that is money, materials required for to render the quality nursing care services. This involving analyzing staffing levels, patient care demands, equipment, supplies and other resources which is required or which are required to ensure or make sure the optimal or maximum care of delivery services for the patient or maintain the high quality and standard nursing care services in the department. Thus, the manager should gather or collect the data or information on historical trend, okay, changing trends or fluctuation in the need of the budget in the hospital, okay, need of the various equipment and supplies to render the services and anticipate. He has to see in advance, foresee the future changes could happen in that particular ward in patient volume, that is number of the admission of the patient, okay, patient volume and service demand of the patient, okay, needs and healthcare demand of the patients in the future. All those things has to be collected data based on the historical trends or fluctuations and anticipate in advance for the future changes in the patient volume and the service demand or care demand of the different patients in the ward, etc. So this all comes under assessing the departmental needs. The second responsibility is maintaining staffing and labor cost, expenditure of the or wage and salary for the staffing and labor cost. Nurse managers are responsible, or nursing superintendent is responsible for estimating the labor cost, okay, determining the or finding out the total labor cost in the particular ward or the hospital, which typically account for a significant portion of the nursing budget. So almost all the nursing budget that covers the or utilized for the labor cost, okay, to providing salary to the staff of the hospitals. Thus, nurse manager are responsible for estimating the labor cost, which typically account for a significant portion, the major portion of the nursing budget. Then this responsibility includes staffing and labor cost includes, one is determining the staffing level, okay, what are the different categories or different types or number of the staff is required. Then second point is overtime and shift differentials. So what are the overtime has to be given to the staff in that particular ward and what the shift should be, okay, 3 shift, 2 shift or more than like that, that is shift differentials. And third one is determining the cost for the recruitment and retention cost for the staff, that is recruitment and retention cost. So the first responsibility is determining the staffing level in the ward or nursing department. That includes assessing the number of nurses, okay, different type and number of nurses and supportive staffs, okay, nursing assistants needed in the ward or the department based on the patient acuity, patient needs and problems and hospital policies, okay. So first one is determining or identifying the number of nurses required and other support nurses or assistant nurse or nursing aides required based on the patient needs and patient problems and the hospital policies. Okay, so number of staff also depend upon various hospital policies according the type of the hospitals and according the different nursing departments. Second responsibility is managing the overtime and shift differentials. So accounting for additional costs such as overtime pay, holiday shift and other shift differentials. So find out what are the additional costs to come for the OT pay, okay, overtime. If the staff is working more than the stipulated shift, she has to pay the double of the amount, okay, that is overtime pay. Or if the staff is coming for the holiday as a reliever for another person, she has to pay double amount for the particular day salary, okay, that is holiday shift. Or the shift difference, sometimes we make a long shift like a 12 hours, like that the shift may change according to different situations. For that also she need additional cost, that has to be find, okay, that has to be accounting, okay, accounting for additional costs such as overtime pay, holiday shift and shift differentials. Then third responsibility is in relation to recruitment and retention cost, that is factoring in costs for hiring, okay, training and retaining the nursing staff in the nursing department, including any expenses which is related to reducing the turnover. Turnover is nothing but periodical movement of the staff from one institution to or this hospital to other hospitals. Actually we are trying to reduce the turnover because when the turnover comes we have to hire the recruit the new staff. For that we have to pay a lot of money. Okay, that has a more expenditure. Okay, so if we maintaining the or retaining the staff in the hospital, we can avoid the recruitment expenditure. So factoring in cost means finding out of the what are the factors, okay, that increase the cost, okay, in relation to hiring, recruiting, in relation to training of the staff. After recruiting, we give the training for the staff in the hospital, okay, in service training program, and we have to give additional benefits, welfare services or incentives to retain the staff, nursing staff in the hospital. This all comes different factors that cost the expenditure in relation to recruitment and retention cost. So factoring in cost for hiring, training and retaining nursing staff, including any expenses that is related to reducing the turnover of the staff in the hospital. The third responsibility is supply and equipment management in the nursing ward. The nurse manager must ensure or make sure that the department has the necessary or adequate medical supplies and related equipment for the quality patient care, which includes inventory control, planning for new equipment and cost-effective purchasing. So responsibilities in relation to supply and equipment management includes first one is inventory control, second one is planning for new equipment, and last one is cost-effective purchasing. First one is inventory control. Keeping track of inventory levels, monitoring the inventory levels or periodical checking of the inventory to avoid the shortages of the medical supplies or overstocking of the medical supplies in the nursing department. So responsibility in relation to inventory control include keeping the track or regular monitoring of the inventory or checking up of the inventory of the nursing department. Okay, that helps to avoid the shortage of the articles to render the nursing procedures or avoid the overstocking of the medical supplies. Okay, then second one is planning for new equipment for the nursing department or for the ward. Planning for new equipment that includes anticipating the need for the new technology, new supplies or new equipment and factoring this cost into the budget. So sometimes new equipment or new supplies are required based on the need of the patient, based on the condition of the patient. So we have already planned a budget. Okay, so in that budget it could be included. For that it has to be anticipated the need for new technology or new equipment or supplies necessary in the nursing department or the ward and factoring that cost, okay, these cost into the particular present proposed budget. Then third one is cost effective purchasing. That means apply the principles of cost effectiveness in purchasing various supplies and equipment for the hospital. So identifying cost saving opportunities, okay, where it is available, when it is available, like that. So identify the cost saving opportunities in purchasing supplies or equipment for the hospital or even negotiating with the vendors. Okay, so bargaining with the vendors or the shop owner in relation to the purchasing of various supplies and equipment to reduce the cost of the particular supplies and equipment. That is comes under cost effective purchasing. So these are the responsibilities in relation to supply and equipment management or control. Then fourth responsibility is monitoring and analyzing the utilization of the various resources available in the nursing department. The nurse manager must analyze, periodically assess how the resources such as staff, time, supplies and equipment are being used in the nursing department. So well utilization of the resources in the ward has to be periodically monitored or periodically analyzed by the ward in charge or nursing superintendent. So the nurse manager must analyze, okay, assess how the resources such as staff time, that is regarding the overtime duties, okay, staff time and different shift and the supplies and equipment in the ward, all how the nurses in the ward or the nursing team are using, okay, that has to be analyzed and that has to be controlled. So this involves, one is evaluating the utilization patterns of the staff of the ward. So evaluating the utilization pattern. Second one is adjusting for the trend. According to the trend, it has to be adjusted. So first one is evaluating utilization patterns, okay, in the ward. So assessing patient volumes, number of patients in the ward, length of stay of the ward, then we can calculate how many supplies are required, okay, for the particular patient. Like that we can calculate for all the patient in the ward, for the day, for the week, for the month, for the year, like that. So assessing the patient volumes, number of patients and type of patient, okay, category 1, 2, 3, like that. Then length of the stay of the patient, how many days, like that. Then the use of various services, okay, or that is needed or required for the patients, all to forecast the or foresee the future needs, okay. So the budget will be based on the utilization pattern of the staff in the hospital. That has to be periodically monitored or checked or evaluated by the nurse manager. Second one is adjusting for trends. So modifying the budget projection or proposal based on the trends, okay. Trends is the fluctuation or change, okay. So patient demand, patient services, everything will be changing in the different month of the year, okay, based on the trends. That has to be understood, then the budget has to be modified. So modifying budget projections based on the trends such as increase the patient admission or shift. Patient admission may vary in the different season of the year, okay, or different month of the year. So that has to be find out, okay. That the budget has to be adjusted according to that. Or changes of shift in the healthcare delivery services or shift in care delivery models. So I have already uploaded a video about the models of patient assignment method or models of nursing care delivery. So according to the different models like team nursing, functional nursing, primary nursing, the expenditure may vary. That has to be planned in advance, and that may be vary according to the number of patients and the different trends of the particular year. So all the things has to be considered. With the help of that information, the budget projection has to modified. So modifying budget projection based on the trends such as increased patient admission or shift in the care delivery models or health care delivery services. Then fifth responsibility is collaboration with the finance department and other departments of the hospitals. So collaboration with the finance and other departments. The nurse manager work closely, okay, cooperatively, collaboratively and coordinatively with the hospital finance department and other departments to ensure the nursing budget align with or balance with the broader organization goals or goals of the hospital or hospital policies or based on the accreditation bodies guidelines, okay. Thus nurse manager work closely with the hospital finance department and other departments to make sure or to ensure the nursing budget is aligns with or nursing budget balance with the broader organization goal or hospital goals, okay. This collaboration involves communicating department needs, okay, communicating the needs of the department to the finance department or hospital finance department. Second one is aligning with the organization goal. So budget is aligning or balancing with the institutional goals or hospital goals, okay. First one is communicating department needs. So clearly articulating the financial needs of the particular department or ward, okay, to the upper management or the finance department or other finance team in the hospitals, okay. So it has to be properly monitored and it has to be planned, then it has to be clearly informed. That is called clearly articulating the financial need of the particular nursing department or all the nursing departments in the hospital to the upper management, top level management and the finance team or hospital finance department. Second one is aligning with the organization or organizational goals. So ensuring the budget support the hospital wide strategic objectives. Usually the hospital is having short term and long term strategic or objectives or goals, okay. So the budget has to be proposed and it should be utilized according to the strategic objectives or plans of the hospital, okay. So ensuring budget to support the hospital wide strategic objectives and compliance with the financial constraints or financial limitation of the hospital, okay. That is nothing but adjusting with the proposed budget as per the hospital policy, okay. So ensuring the budget which support the hospital wide different strategic objectives and goals and compliance balance with or follow with the financial constraints of the limitation of the hospital authority. Okay. The sixth responsibility is related to budget forecasting. Forecasting the budget for the nursing department. Nurse managers are responsible, or nursing superintendent are responsible for forecasting the future financial needs of the department or all the nursing department of the hospital or wards. So it is a clearly vested responsibility of the nurse manager for or to forecast the future financial needs of the all the wards or nursing departments in the hospital. It requires projecting the cost or expenditure and long-term planning for the financial sustainability and considering the changes in the healthcare regulations by the government or other accredited agencies. First one is regarding projecting the cost. So estimating the future expenses of the ward, okay, nursing department, such as wage increases for the health personnel or nursing staff, new hires or recruitment, and raising the supply of the cost. As you know that every year the cost of the supplies and the equipment will be increasing. Okay, so that has to be understood. That is raising the or increasing the supply cost and incorporating these informations all into the budget proposal or budget estimation. Okay, so estimate the future expense of the nursing ward, such as wage increases or salary increases of the staff, new hiring for the hospital, that is new staff recruitment, and raising the supply of the cost or increasing the cost of the supplies and equipment, and all that has to be incorporated. Okay, all that has to be connected into the budget proposal. Second one is long-term planning. So planning for long-term investments to increase the fund, okay, or to increase the budget. So planning for long-term investments such as education programs, capital improvement, or other technological upgrades to increase the budget or profit or outcome of the hospital. Okay, so long-term planning, or that is includes planning for long-term investments, okay, for the hospital to increase the budget, okay, as education programs or educational initiatives, then capital improvement, okay, by selling the shares, etc. Okay, capital improvements and technological upgrades for the easy functioning and smooth functioning to increase the profit of the hospital. Then last one is considering the changes in the healthcare regulations. Healthcare regulatory agency periodically will make different policies, different rules and regulations. So that has to be adjusted with the financial constraints. At the same time, so hospital has to render the quality based comprehensive nursing services. That includes adjusting the budget to account for regulatory changes of the regulatory bodies or reimbursement policies. That is a welfare policy for the staff, reimbursement policies, or government mandates or government mandatory act. Okay, the rules and regulation that may affect the nursing operations. So nursing functions or nursing care procedures, nursing operations may affect, okay, with the current regulatory changes, reimbursement policies of the hospital or government new rules, compulsory rules that has to be done something to that employees like that. Okay, all these things has to be adjusted when the budget is proposed or estimated. Okay, so that is the responsibilities in relation to considering the changes in healthcare regulation when propose the budget or when make the budget for the nursing department in the hospital by the nurse manager. The seventh responsibility is managing the operational cost or functional cost of the hospital. Okay, service cost. The nurse manager must find different ways, okay, or means to manage the operational cost or functional cost effectively without compromising the patient care. So we are not compromising the patient care. Patient has to get the high quality, comprehensive, patient-centered care. At the same time, the functional cost has to be reduced, okay, in the budget. Okay, thus nurse manager must find different ways, okay, different steps, okay, to manage the operational cost or functional cost of the hospital efficiently and effectively without compromising the patient care. For that, the responsibility includes cost containment and improving the efficiency of the staff. Under cost containment, that includes identifying the areas, different areas where expenses can be reduced. Okay, so there are many ways are there, many steps are there. Only thing to find out which area the expenses can be, the expenditure can be reduced. Okay, that has to be identified, that has to be determined. So identifying the area where expenses can be reduced, such as minimizing the overtime duty for the staff. So overtime means we have to pay the double of the salary. So that has to be reduced maximum. Then optimizing the schedule. Okay. The nurse's duty schedule has to be optimized, balance. Okay. So long term shift, additional shift, holiday shift, etc. could be managed. So optimizing the scheduling and reducing the wastage of the supplies and equipment by the staff, etc. These are some of the factors can reduce the hospital expenditure or cost to maintain the cost containment. That is nothing but reduction of the cost or expenditure. Then second responsibility is improving the efficiency. So implementing process, various implementing process to improve the efficiency of the staff, such as streamlining the workflow, okay, monitoring the workflow, performance appraisal of the staff, etc. So streamlining the workflow, supervising the workflow, and making energetic services from the staff, or introducing time-saving technologies in rendering various nursing procedures and nursing functions in the hospital department or nursing department. So implementing process improvements that enhance the efficiency of the staff. So to increase the skill and efficiency of the staff, such as streamlining the workflow or introducing the time-saving technologies in the field of the nursing practice or rendering patient care services or operational functions of the nursing department or hospital organization. So these are the two responsibilities under managing the operational cost of the hospital. Then eighth responsibility means variance analysis and reporting. Analysis the or monitor the or check the various or observe the variance which occurs, different factors that increase the budget of the hospital or nursing department and report to the higher authority. That is variance analysis and reporting. After the budget is in place, once the budget is proposed, the nurse manager must monitor or periodically monitor or inspect the actual performance of the budget against the estimated or proposed budget. So estimated budget always will make a 10% more than that the actual budget. Okay, that has to be compared, the proposed and actual budget. So that has to be periodically monitored. It is the responsibility of the nurse manager or nursing superintendent or ward in charge to see the or to monitor the actual performance of the budget against the proposed or estimated budget. This includes, one is analyzing the different variances or factors. Second one is taking correct actions or corrective actions based on the variances. And last one is reporting to the higher authority or to the leadership. Reporting to leadership. First one is analyzing the variances. So identifying the discrepancies between the budgeted and the actual expenses and understanding the reason for this variance. So there would be changes of proposed budget and actual budget. So identify why it is changed, why there is a change or either increase or decrease. So find out that reasons. Thus find out the reason for that discrepancies. Okay. For example, unplanned staff absences. So sometimes staff may be periodically absent. So we have to put a reliever. Okay. So we have to make a overtime of the people that increase the expenditure for the salary of the particular staff. Or sometimes increase the patient volume due to an outbreak. So we need more resources, more staff. That also increase the expenditure. So such discrepancies may occur regularly in the financial year in the hospital. Okay, that has to be identified. So identify the discrepancies between the proposed budget and the actual expenses that took place or taking place, and understanding the reason why it is happening. Okay, for these variances, and to take measures. Okay, taking corrective measures to balance the budget. That is the second responsibility, taking corrective actions. Implementing various measures to address the budget variances, okay, discrepancies, such as adjusting the shifting of the staff, okay, in the ward, or reducing the non-essential or unwanted expenses. So reducing the non-essentials or unwanted expenditure in the ward. Then third one is reporting this to the leadership. So providing regular financial report based on the discrepancies, based on the variances, etc. Okay, to the senior management or finance department. That includes explaining any significant variances and giving some solutions. So that is proposing the solutions to combat that discrepancy or that variances. That is included reporting to the leadership. So providing regular financial report of the nursing ward by the nurse administrator or nursing superintendent to the senior management or financial department, and explaining the significant variance, important variances which could take place in the year at the same time, and proposing or informing or instructing various solution to overcome that particular discrepancies which occurs throughout the year in the hospital or organization. The ninth responsibility is incorporating quality improvement initiatives or programs in the hospitals. Incorporating quality improvement programs. The nurse manager must balance the financial constraints or financial limitations with the quality improvement goals and measures. Okay. So to improve the quality of the patient care with minimum cost, okay, that is application of health economics, okay, the nurse manager must balance the financial constraints or restrictions limitation with the quality improvement goals set by setting up various quality improvement goals. This includes budgeting for training and education for the staff, training and education and quality control programs or quality assurance programs at the hospital. So first one is training and education. So allocating the fund for continuing education or in-service education and training program to the staff nurses to ensure that nurses stay up-to-date knowledge, okay, with the latest practices and nursing care standards. So that is the quality improvement goals. So training and education of the staff in the nursing department by doing continuing education services or in-service education program or other training programs that make sure the nurses to have a updated knowledge in relation to patient care services. They have latest or advanced evidence-based practices and thus they can maintain the standards of the or professional standards of the nursing. Indirectly, this would increase the quality of the services. At the same time, it reduces the financial constraints or expenditure. The next one is quality programs. Supporting all the quality improvement programs, okay, quality assurance programs or quality improvement initiatives in the hospital that is aimed at enhancing the patient safety, or making sure the safety of the patient in the hospital and positive outcome of the patient, okay, satisfactory outcome such as fall prevention program, related problem or complication in the hospital setting, or infection control measures to prevent the infection in the or secondary infection to the or nosocomial infection in the hospital settings. So supporting quality improvement initiatives or programs aimed at enhancing the patient safety and patient care outcomes. Okay, so some of the examples: implementing falls prevention program and giving more importance about the infection control measures and programs or initiatives in the hospital. The 10th one is risk management and contingency planning. Risk management, emergency crisis management. The nurse manager must include the provisions, okay, for unexpected events could take place in the year, okay, such as surges in patient volume. Surges means increasing the patient volume or admission, okay, due to any calamities, natural disaster outbreak, okay, or emergency situation may take place, okay. Example, as I said, the disease outbreak, okay, that we have witnessed during the COVID outbreak, okay. So then various natural calamities, flood and other things, all will increase the patient volume in the hospitals, okay. The responsibility related to risk management and contingency planning include creating contingency fund, okay, setting aside funds to cover unexpected expenses such as emergency shifting or equipment repairs. So electronic equipments anytime can have a failure, okay, so we have to foresee that, okay. So we have to keep at least 10% of the total budget for the such maintenance and repair work. So setting aside the proposed budget to cover the unexpected expenses which occur, such as in emergency situation, that is emergency staffing is required when there is a surge in patient volume in the hospital, or during that period the patient need more supplies and more equipment, okay. So that may lead to failure of the particular equipment, okay, that has to be get repaired immediately. For that we need additional expenditure, okay. That all comes under making contingency fund, extra fund for the unexpected expenses. The next one is planning for the crisis. Of course, crisis may occur at any time, okay. That has to be planned or prepared in advance. So ensuring the nursing department is financially prepared for the crisis or to manage the crisis, like natural calamities or disasters, pandemics, that is outbreaks, or other unexpected situation could occur, okay, in the year. So that comes under planning for the crisis. So we need a separate or setting aside the fund or the budget for crisis management and other emergency occurs or unexpected situation occurs in the hospital, okay, by making contingency fund. That comes under risk management and contingency planning while making the budget or proposing the budget. The last one is compliance with the legal and regulatory requirements. So there are many legal act, okay, or rules and regulations, or legislatory measures, or the regulatory guidelines. Okay, all this has to be followed by the hospital or nursing department. Thus, nurse managers must ensure that the budget is compromised to the all the legal aspects of legal issues and problems which have occurs, or the legislative norms has to be are following, and all accredited standards are following or adhering by the hospital management or nursing department. So nurse manager must ensure or make sure that the budget is adheres to solve the legal issues or legal problems, and to solve the regulatory norms, or to follow the accreditation guidelines for making the professional standards for rendering quality based patient centered services. This includes allocating the special fund for compliance initiatives. So for that also we have to make different initiatives. For that we need extra fund, and ensuring that the department operates or functions within the financial constraints or financial limits that is imposed by the healthcare regulations of the government or other accredited agencies. Okay, so we have to render the quality services, but we have the limitation based on the financial constraints that set by the healthcare regulation. For example, regarding the admission fees or regarding the investigation fees, okay, collecting from the patient, all is comes under healthcare regulations or government instructions or guidelines or regulatory norms. So this also has to follow by the hospital management or the nursing department. To overcome that, they have to allocate a different or special fund compliance of such initiatives to render the quality patient care or patient centered care in the hospital. So this is comes under compliance with the legal and regulatory requirements. So all the legal and regulatory requirement has to adhere, has to solve, has to compromise by the management or hospital authority. Okay, at the same time they have to improve the standards of the hospital, improve the quality and comprehensive healthcare services to the patient. So thanks for watching. Hope this video really benefits in your studies and exams. If you feel it is really worth and beneficial, please like, share and subscribe my channel, and stay tuned with the Angel Health Academy for the next and important academic video. One important thing is, don't forget to convey your regards in the comment box. So once again, thank you for watching my video. See you and take care.